Goni Wrist, ulnar deviation. Position the patient in sitting next to a supporting surface with the shoulder abducted to 90 degrees and the elbow in 90 degrees of flexion. Position the forearm midway between supination and pronation so that the palm of the hand faces the ground. Rest the arm and hand on the supporting surface. Remember to test the unaffected limb. In patient-appropriate language, ask the patient to ulnarly deviate the wrist. Assess the forearm for supination or pronation and the elbow for flexion less than 90 degrees. Ulnarly deviate the wrist by moving the hand towards the fifth digit. Maintain the wrist in 0 degrees of flexion and extension and avoid rotating the hand. Stabilize the forearm to prevent supination and pronation and elbow flexion less than 90 degrees. The end of wrist ulnar deviation range of motion occurs when resistance is felt and additional motion causes the elbow to extend. Assess the end field of the joint. This is firm because of tension in the radial collateral ligament and the radial portion of the joint capsule. Tension in the extensor pollicis brevis and abductor pollicis longus muscles may contribute to the firm end feel. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer on the dorsal aspect of the wrist over the capitate. Align the stationary arm with the dorsal midline of the forearm using the lateral epicondyle for reference. Align the movable arm with the dorsal midline of the third metacarpal. Do not use the third phalanx for reference. Ask the patient to perform ulnar deviation of the wrist as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the forearm and elbow. Read the degrees of motion on the goniometer and then ask the patient to return the wrist to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 30 degrees.